Hello, in this video we are going to talk about dengue fever, its clinical features, investigations, and treatment. But we start, if you haven't subscribed to my channel, so subscribe to it and press the bell icon for more videos. Dengue viruses, a member of the Flaviviridae family, are transmitted to humans through bites of infected female Aedes aegypti mosquitoes. These are found mainly in Asia, Africa, Central America and South America, where it is a common cause of fever and may be fatal. Clinical features. After an incubation period of 4 to 7 days, there is an abrupt onset of fever, headache, retroorbital pain and severe myalgia, often with a skin rash. Dengue hemorrhagic fever is a severe form with thrombocytopenia, increased vascular permeability, ongoing fever and spontaneous bleeding. Additional signs of circulatory failure indicate dengue shock syndrome. Diagnosis. Initial diagnosis is mainly clinical, and it should be considered in all travelers returning from endemic regions. Laboratory diagnosis usually relies on serology, which should be taken 5 days after the onset of illness. PCR detection of the virus or its components in the blood is also available for an earlier confirmation. Treatment. Treatment is supportive as no specific therapy is available. Early recognition of deterioration to DHF should identify patients who require more aggressive supportive approaches. That's it for now. I hope you like it. Thanks for watching, and don't forget to press subscribe button.